Today we will discuss the topic protect your kidneys to save your heart. If all the measures they which are used for protecting the kidneys, they will also save your heart. So protect your kidneys to save your heart. So what are the kidneys? Kidneys are two bean-shaped organs present below the rib cage on either side of the vertebral column, and they are the size of your fist. In the urinary system, the kidneys make urine, which is transmitted through two tubes known as ureters to the urinary bladder, which stores the urine, and it is excreted through the urethra. The kidneys consist of 1 million filtering units in each kidney. These filtering units are known as nephrons. Each nephron unit consists of glomerulus, that is the filter, and the tubules. The filter, it filters the blood. Now the filtrate goes to the tubules, which keep the reabsorb the useful substances, and finally the urine is made, which is excreted and to the outside through urethra. So what are the functions of the kidney? Because there are 1 million nephrons in each kidney, your body can work normally with a single kidney. So some patients have uh, one kidney by birth. So when the kidney functions start deteriorating, it means both the kidneys are affected. Sometimes the patient asks, "Sir, both the kidneys are affected or only one kidney is affected?" If only one kidney is affected, you may not know it, and because the kidney functions will be normal. So the kidneys make urine and they purify blood. They remove waste products from the body, mainly the nitrogenous end products of the protein metabolism. The kidneys remove excess fluid from your body and they maintain the fluid balance in the body. Kidneys also balance the minerals and chemicals in the body like sodium, potassium, calcium, phosphorus, magnesium, etc. So they keep the internal atmosphere of the body normally. Kidneys help produce red blood cells by secreting hormone erythropoietin. They help in manufacture of the red blood cells, that is the hemoglobin. They also maintain healthy bones by secretion of the hormone which maintains vitamin D and calcium metabolism. So they make strong bones and teeth. Kidneys control your blood pressure by secreting the hormone renin. That is very important function of the kidney. The kidneys and heart connection, the kidneys and heart, they are closely related to each other. The heart pumps your blood and the blood pressure is how strong your heart beats. So your kidneys help control your blood pressure. So in the diseases of the kidney, the heart is affected, and in heart disease, the kidneys are affected. So the global burden of chronic kidney disease. The chronic kidney disease is rising as in epidemic proportions. Around 850 million people are affected. 1 in 10 adults worldwide has chronic kidney disease, and the global burden of chronic kidney disease is increasing, and it is causing increased mortality, cardiovascular mortality, and the kidney failure, the treatment of which is very costly and very complex. The treatment of end stage kidney disease, even the developed countries are feeling a financial pinch. And there is six-fold increase in mortality rate associated with diabetes and chronic kidney disease. So mortality increases. Or in a developing country like India, around 2 lakh new end stage kidney disease patients appear every year, and only 10% can receive dialysis or kidney transplant. That is the kidney replacement therapy. So rest 90% cannot afford the costly therapy for end-stage kidney disease, hence the need for prevention of the kidney disease. So let us see what are the causes of the chronic kidney disease, which is a slowly progressive and irreversible loss of the filtering units of the kidney. Diabetes and high blood pressure are the two major causes of chronic kidney disease. The other causes are obstruction due to kidney stones, hereditary glomerular disease like polycystic kidney disease, Alport syndrome. Then other causes are glomerulonephritis. So diabetes and high blood pressure often coexist with chronic kidney disease. These three diseases, diabetes, high blood pressure, and chronic kidney disease, they are the sister diseases. If you have diabetes, look for other two diseases. Check for high blood pressure and check your kidney function test. So, if you have high blood pressure, check for diabetes, check your blood sugar level and serum creatinine level also, that we will see. So, these three diseases may coexist together. And the high blood pressure can lead to chronic kidney disease, and the chronic kidney disease can lead to high blood pressure. So, if you have high blood pressure, you may develop chronic kidney disease. So, you should control your hyper BP. And if you have chronic kidney disease, you control your blood pressure very well, that it may slow the progression of the kidney disease. So, in chronic kidney disease occurred first, or the high blood pressure occurred first, it is very difficult to differentiate at a later stage. Now, the obesity is now a global epidemic, and the obesity is associated with high blood pressure as well as kidney disease and other diseases also, type 2 diabetes, increased cholesterol, obstructive sleep apnea, joint pains, and other problems, and even the cancer risk is high associated with obesity. And the matter of great concern is that our children and adolescents, they are becoming obese and they are developing high blood pressure at a very early age. So this is a matter of great concern, and that is because of the cola culture, McDonald culture, prolonged sitting on computer, laptop, and almost nil physical activity, nil outdoor games, etc. So the chronic kidney disease and cardiovascular disease and diabetes is a disease multiplier. If you have chronic kidney disease, there is high risk of developing cardiovascular disease, that is the heart attack, paralytic stroke, and peripheral vascular disease. So the diabetes and chronic kidney disease, they are the risk factors for development of cardiovascular disease. So what are the symptoms of kidney disease? Chronic kidney disease is a challenge because it's a silent disease. So unless you get the checkup done, you may not recognize. There are no signs symptoms in the initial stages, and in later stages there may be nausea, vomiting, lack of appetite, and then high blood pressure, swelling. So it manifests its effect on other systems also, like anemia and bone disease. So early stages, no sign symptoms. You have to check the kidney function test to know if you are having kidney disease. And as the disease advances, it may cause frequent urination, tiredness, weakness, lack of appetite, swelling of hands, feet, and ankles, shortness of breath, blood in urine, puffiness of eyes, dry and itchy skin, in trouble in concentrating, trouble in sleeping, numbness of feet or hands, nausea, vomiting, muscle cramps, high blood pressure, or darkening of the skin. See, these are the all signs and symptoms when the kidney disease advances. So, how to diagnose chronic kidney disease? As I told you, it's a slowly progressive and non-reversible disease of the filtering units of the kidney. So normally the filtering units, that is a nephron, 1 million in each kidney, they make urine and they retain the red blood cells. The filter red blood does not allow the proteins and red blood cells to pass through the filter. So the urine does not contain proteins or red blood cells. But as the filter is damaged, the pores become larger. The protein start appearing in the urine. That is the albumin present in the urine. Red blood cells may be present in the urine. So urine examination, presence of protein in urine, that's a marker for kidney damage. And then there is retention of the nitrogenous waste products in the body. So the urea and creatinine also start rising. So, whom we should test? Who are at the risk for developing kidney disease? So, the risk factors include people with diabetes. They have more risk for development of the chronic kidney disease. Those who have high blood pressure, those who have heart problems, those who have family history of kidney disease, those who are smokers, those who are obese, and then 60 plus elderly people, and there is past history of acute kidney injury. So these are the people at risk for development of chronic kidney disease, and they should be checked for kidney function tests. So the blood and urine tests are the only way to know if the chronic kidney disease is present. So the BP must be recorded in all cases. If the blood pressure is high, the blood pressure might have caused kidney disease, or the kidney disease might have caused high blood pressure. So blood pressure must be recorded. Routine urine analysis will show protein in the urine, and from that we can detect spot urine protein upon creatinine ratio to quantify the amount of protein excreted in the urine. Then you should know about your serum creatinine. That's a blood marker for chronic kidney disease. And from this creatinine estimation in blood, we can estimate the filtering power of the kidney, that is GFR, glomerular filtration rate, that is normally 100 to 120 ml per minute. So you should know, as you know your blood pressure, your cholesterol, your blood sugar, you should also know your serum creatinine level above 40, and persons with all those risk factors we have described, they should check their serum creatinine once in a year. So start knowing your serum creatinine level. Then there is non-invasive test for kidneys, ureter, and bladder. You can see the size of the kidneys by ultrasonography of the kidney. This is a simple non-invasive test. You can know the kidneys are enlarged, or they have become smaller, or they are obstructed. In chronic kidney disease, usually the kidneys become small. So when the ghosts come in the dreams of a doctor, they do not ask why my CT scan was not done. They ask why my urine examination was not done, or why my blood pressure was not checked earlier. That is to show the importance of BP check and urine examination. So how to manage the chronic kidney disease. This is to emphasize that management of chronic kidney disease and the advanced chronic kidney disease is highly complex and very costly therapy. Hence, all efforts must be made for prevention of chronic kidney disease. So, in early stages, we do the conservative management, no dialysis. How? Good control of blood pressure, blood sugar, and weight, diet control, low protein, low salt, avoid salt substitute. If you have chronic kidney disease or the kidney functions are deranged, then salt substitutes which contain potassium chloride must be avoided. As far as the low protein is concerned, those who are vegetarians, they need not restrict their protein further. And avoid strong painkillers, drugs and antibiotics affecting kidney. Then we manage the complications of chronic kidney disease like anemia and bone disease. Then, if you have chronic kidney disease, the vaccinations should be taken against hepatitis B, flu, pneumonia. Once the kidney functions start deteriorating, by all these measures, we can slow the progression of the kidney disease, but we cannot bring serum creatinine back to normal. And the kidney functions when there are less than 10% of the normal, that is known as end stage kidney disease. Then the kidneys are no longer functioning. Then the life can be maintained by dialysis and kidney transplantation. This is known as kidney replacement therapy, that is dialysis and kidney transplantation. So the varieties of dialysis, that is hemodialysis, done by the machine. You go to the dialysis unit 2 to 3 times in a week for 4 hours. You are attached to the machine, and the machine does the filtration for you. And then there is peritoneal dialysis, that is the home dialysis. A catheter is placed inside the abdomen. You put 2 liters fluid, and that is you take it out after 5 or 6 hours, and it is done exchanges for 3 or 4 times in a day. That you can do yourself. That is the home dialysis, or you can use automated peritoneal dialysis, that is done by the machine during night, and during daytime you are free. The kidney transplant is the best option for end stage kidney disease, provided the donor is there. So the donor can be a living donor or cadaver donor. So in the donor kidney is transplanted in the lower abdomen, and the patient's diseased kidneys, so small shrunken kidneys, they are kept there. They are not touched. So the healthy kidney is transplanted to the patient. So, see, this dialytic therapy, kidney transplant therapy is highly complex and uh, costly therapy. Only 10% people in a developing country like India can afford. Hence, there is need for prevention of chronic kidney disease. So, let us see how to keep your kidneys healthy. That will protect your heart also. As we know that the diabetes and high blood pressure, they are the two major causes for chronic kidney disease. Both can be prevented by lifestyle modifications, healthy eating, and regular exercise, that we will see. So diabetes, high blood pressure can be prevented in the community, and so the early detection of diabetes, early detection of high blood pressure, early detection of chronic kidney disease will be helpful. So, how we can prevent chronic kidney disease? Number one is keep fit and active. 30 to 40 minutes of active exercise, physical exercise, whatever way you like, cycling, walking, dancing, swimming. Park your car away from your office. Go to the, take the lift. Don't take the lift, take the staircases. So 30 to 40 minutes of exercise or brisk walking or the equivalent exercise, move for your kidneys. Eat healthy food to ensure good nutrition and good control of your blood sugar level. Then there is a dash eating plan, dietary approach to stop hypertension, dash eating plan for high blood pressure, that consists of using plenty of green leafy vegetables, fruit, low fat dairy products, fish if you are non vegetarian, and avoid less of sugar and less of saturated fats, avoid alcohol. So the dash dietary plan: sprouts, fruits, and vegetables. Monitor your blood pressure is very important. Keep your blood pressure as near as normal as possible. That is 120 by 80, and never exceed 140 by 90. And those ladies who had high blood pressure during pregnancy, subsequently, even if the blood pressure is normal, they should get the BP checked every year. So monitor your blood pressure and keep it normal. There is a relation between salt, that is the sodium chloride, high blood pressure, and kidney disease. So salt must be restricted. Eating salt in excess leads to high blood pressure and fluid retention. Salt intake need to be restricted from around 4 to 6 gram per day. And those who are having kidney dysfunction, or those persons with high blood pressure or diabetes who do not know about their kidney functions, never use salt substitutes without the consultation of a doctor, because they contain 50% sodium chloride, 50% potassium chloride, and there may be high potassium level in the blood, which may be toxic to the kidneys. So, why low sodium salt is bad for health? You have written an article in Times of India that they have higher potassium levels in the salt substitutes may affect your muscles, your heart. So, without the advice of the doctor, you should not take salt substitutes like Lona salt, Tata Plus, etc. No special salt. Then maintain a healthy fluid intake, 2 to 3 liters of liquids daily. Then do not smoke, no tobacco or tobacco products. Avoid passive smoking also. Do not take over the counter painkillers on a regular basis. Similarly, the Ayurvedic medicines which contain heavy metals, they may be deposited in kidneys and liver and may be toxic to the kidneys and liver. And certain Chinese herbs can lead to Chinese herb nephropathy that contains aristocolic acid. So avoid Chinese herbs. So to summarize, the prevention of chronic kidney disease, to follow 8 golden rules to improve your kidney health. Keep fit, be active, that is maintain ideal body weight, that reduces blood pressure and the risk of chronic kidney disease. Eat a healthy diet, no, salt less than 6 gram, plenty of green leafy vegetables and salad and fruits. Check and control your blood sugar. Take appropriate fluid intake that I have described. Check your control your blood pressure. Do not smoke. No tobacco or tobacco products. Do not take over the counter anti-inflammatory or strong painkillers, and get your function checked every year. Kidney function checked. If you have one or more of the high risk factors, that is, if you have diabetes, high blood pressure, you are overweight or obese, or you have a family history of kidney disease, check your kidney functions. That is urine protein estimation, urine examination, blood pressure check, and serum creatinine level in blood. So protect your kidneys. All these measures to protect your kidneys will also save your heart. Thank you.